Welcome to PBM Tea, where we get real about the pharmacy benefits industry, talk strategy, and spotlight the leaders doing things differently. I'm Keith Croft, Director of Account Management for SGRX, and today I'm excited to sit down with two leaders who are not afraid to challenge the norm.
Thank you, Keith. I'm Vikki Columbus. I am co-owner and Chief Pharmacy Officer for SGRX.
I'm Russell Trujillo. I'm EVP and co-founder of MotivHealth Insurance Company.
Let's talk about the partnership between SGRX and MotivHealth.
Thanks, Keith. We were actually just talking this morning about how we've been working together since 2017. So this is our 8th year in partnership, and we've both experienced tremendous growth during that time, and fortunately have had aligned goals and values the entire time.
Yeah, I think it was interesting. It was relationships that brought us together. We had people that worked together in the past that allowed us to take a look. It was interesting in that we were a pretty innovative company. We started with the idea that there's got to be a better way, and so we had this innovation in our DNA, and we were working with a PBM, and every time we tried to do something different or even approach something different, we didn't feel like we had a partnership. And so when we started with Script Guide, I don't know if you remember this, but the first contract, I was Vikki, I think we're gonna, we'll have a 1-year contract. After that, we probably want to be our own PBM. And then because we didn't know that we could find a partnership that would actually help carry us forward together like that. And obviously we haven't and don't plan to because we did find that partnership we needed.
From your seat at Motiv, what's been the most surprising challenge or shift over the last year?
So I'd say it's probably more than a year, but cost largely driven by utilization. And so if you think about the utilization increases over time generally, especially as technology grows and things like that. But we've seen post-COVID that utilization has been on a steep incline for a long period of time, much more than anybody's ever expected. And so you see this across the whole industry where all the carriers are seeing much higher claims costs than they were expecting. It's been climbing faster than we can get ahead of it. So that's kind of what's happening there. Obviously, a large part of that, bringing that back to the pharmacy side, is there's always another wave of the next drug or category that's driving utilization. And in this case, right now, we're in the weight loss drugs, right? And so, one time it was insulin was going to bankrupt the system. Now it's weight loss drugs. And so a lot of people thought this would be great. Let's cover them. It'll make everybody healthier. And then you don't get that kind of health outcomes, and yet the costs are still climbing. And so then you see this shift backwards. And so there's a lot going on around that. And one of the things, if you think about healthcare costs, pharmacies always increased a lot faster than the rest of the claims. And so it is now the largest major component of claim spend in the whole claim system. So it's 28.9% of all claims now. We knew it was coming, but it's finally here. It's finally here.
Do you think that traditional PBMs are capable of meeting the moment to address some of those challenges, or is that kind of beyond what they're built for?
So I think the if you think about the PBM model, the big PBMs, the three majors that control, everybody always talks about 80+% of the total claim spend out there in pharmacy. They have a very different, they have a very specific model that's evolved over years. Their model is largely this rebate-driven kind of model, and it's going to be hard to interrupt that because there's a lot of money in that, and so that makes it really hard for them to change their model. Not impossible. I'd love to see them do something a little different. You probably don't, because this is how you differentiate. But I think that it's hard to stop something so big and change it around. So I don't know that. I don't think it's going to happen. I'd love for it to happen. If you think about changing landscapes in any business, you think about I'll use totally different industry, Blockbuster versus Netflix, right? Blockbuster leader in the industry. Everybody knew who they were, but they couldn't change. And so they don't exist anymore. I think maybe there's one in Alaska or something. I can't remember. But in Netflix, they could see that change coming. And so then they converted to a different model. And now they're thriving quite well, right? And I just don't know. I don't know if the large PBMs can and will do that. And maybe, we'll see how the money flows. We'll see if they're able to do that. What do you think what do you think makes you different? I mean, I've already told you kind of what I think a little bit, but what do you think makes you guys different, makes you ready for that, for the next evolution in healthcare?
Yeah, good question. I think we're ready. We've always been, right? We're already functioning in that kind of, member-centric, aligned incentive, transparency mode. So luckily, SGRX was founded by a husband and wife that were in public health. And so, it's been part of the fabric of the organization from its inception to have that kind of humanistic approach. And so when Ime and I took over the company in 2017, we brought, our expertise from some of those bigger PBMs in terms of infrastructure and training and programming, but kept that humanistic culture. And so, we both worked extensively in the Medicaid space and the Medicare space. So, flexibility and innovation and creativity really are second nature for us. And I think that's why we've always worked so well together with Motiv, because it's just how we think, right? Our model has never been what's in it for us. How can we get, high money and rebate fees or, take spread without you knowing about it. It's always been a real partnership for us.
I agree with that. I think that the culture is a main component of to be able to do anything different. You have to have a culture that starts that we are going to be different, that we are going to be better. We're going to do something a little bit different. And in fact, that member-centric, I love that you said that, because you have to start with the member. You can't help a plan, you can't help a group, you can't help a client unless you help a member.
Absolutely.
So,
let's talk about a topic that is clearly important to both organizations, which is transparency. How do we make sure that we continually do the right thing by our clients and stay transparent? So
for Motiv, we started with kind of this idea that healthcare is too expensive, and we thought how you would make an effect in that crazy system, this crazy healthcare system, is that you have to have the member as the center of this, and that means you have to engage with that member. So it's not just the insurance company that paid a claim or denied a claim or something like that. You're actually engaging with this member, that you are a healthcare partner with them. You educate the member. So you talk about, you help them understand that here's all the different options that are available to you to meet your healthcare needs. And then they can make their own decision, right? And then we reward them or incentivize them for making good decisions. And so for, at the beginning of that, or the base of that, is transparency. We have to educate them. We have to share information with them. And so we started off with information about how much does it cost to go to get an MRI? And, how much does it cost here versus there? We do the same thing with pharmacy. You guys have tools online, that we utilize, obviously, that do things like that. And then when we talk about all these different programs that are available, that we work with on pharmacy, we share that information with a member and hope that they make the right decision, but it's always their decision. So that's how we start with that transparency in it.
Great. I think from our perspective at SGRX, we have a pricing model that is all inclusive. So, you know exactly what our commitment to you is in terms of service. And so, we aren't nickel and diming every single program, mailing, update, online database. And so, there are no hidden fees. And I think that just engenders a level of trust there that is critical so that both organizations can continue to serve the best interest of the members.
Yeah, I like that. So I feel like if you don't have a partner that's transparent, then you don't have a partner, right? And the thing is that you need and want your partners to succeed. And so they've got to earn money, right? Because they won't sustain if they don't. And you just want to understand, how do they earn money and how do you work together? And so I appreciate that. That's what our relationship is and always has been. So.
Yeah, and jumping into one of the specific programs that SGRX and MotivHealth implemented, the Cuban Cost Plus Pharmacy program. We implemented that about 2 years ago. So, Russell, from your perspective, what really prompted you to become an early adopter of the program?
Great question. I think we're always looking for ideas. How can we serve our members better? A lot of the programs we have evolve from a member's need. And so cost is just one of those things. When Cuban started talking about pharmacy, it was interesting because it was one of those things that we all agree, we all know it costs too much, and there's just this crazy system that's in place that drives those costs, and a whole bunch of players in the middle that generally don't add much value, if any at all. And so the idea made sense. And so I think that when we first seen that, we were always looking for, where's that opportunity that we could actually start jumping in and doing it, working with them. And so as they evolved and as we evolved, then I think we seen that opportunity, and that's when we said, okay, hey, here's where we think that there's probably something we can start doing together. So that's, I think that for us, that's kind of how we get there. And then of course, you guys are along with us the whole time. So then we're like, okay, now how do we make this happen? And then we have to look to you guys to help us make it happen.
So there's always hesitation in disrupting that supply chain that you alluded to from many payers. What helped MotivHealth kind of push past that and take action?
Yeah, I think as we've talked about already, we don't play the same game as everybody else. We're not looking for rebates. We'll try to maximize rebates for what we do, but what we do comes first. How do we help that member has to come first. And so for us, just like any of the other programs that we've implemented, it's reaching out to them, understand who could be affected in this of our members, start reaching out to those members and having those conversations beforehand. For us, it was never a problem on the rebate side and going through the normal process. We're always happy to go a different direction on that. And then it's just starting to work with our members. That's how I view it.
And you mentioned reaching out to members, and obviously there had to be conversations with your clients as well. What was the feedback and what was the response like?
Yeah, I think we're probably a little unique. So I don't know that everybody will have the same experience in that our members are used to us calling them. They're accustomed to us saying, look, here's a way that may save you some money, and so here's this opportunity for you. And so we're constantly mining data and looking at opportunities to help our members with. We turn those into cases, and then we actually have our people calling our members. I mean, it's just literally that. I mean, that sounds simple, but it is we have to call and talk to them. We have to help them understand. That goes back to that education kind of a thing. And so the feedback, the engagement rates with our programs is greater than 90%. We don't force anybody to do anything. We give them education and then they make those choices. And so, when you have greater than 90% participation, I think that's the feedback that we're looking for. And then the other side of that is member satisfaction. Our member satisfaction, we survey them, and I think you're more likely to get someone with a negative aspect taking a survey than a positive, and yet we're up to 98% member satisfaction right now. So as we talk about what it looks like on our side for rolling out programs, and specifically the Cuban program, what what do you guys see?
Yeah, I mean, for us, it was really quite seamless, right? So our standard process is when new medications come down the pipeline, biosimilars included. So Yusimry, Brenzavvy, and Otulfi, which really are the drivers in the Mark Cuban Cost Plus program, those had already been vetted through our P&T committee. And so it was...
So
yeah.
for people who don't know what a P&T committee is,
Thank you.
what's P&T?
So Pharmacy and Therapeutics Committee. So one of the services that SGRX provides to Motive is a clinical review process by a group of physicians, pharmacists, nurses. As new drugs come down the pipeline, we do class reviews, et cetera. So, we make sure that not only is a drug cost savings, which, obviously all of the drugs in the Mark Cuban program are, but they're clinically appropriate so that your members are still getting what they need from an outcomes perspective.
So obviously, I like that you're talking about health outcomes. One of the things I've always appreciated is how your team is always telling us what's on the horizon, especially with the biosimilars. That was one thing, and I'll call out Marge directly, that I love how she brings all that information to us. And so it helps give us ideas of, what's the next place that we can actually make a difference for our members, both for cost and health.
Yeah, and just to piggyback off of that a little bit, talking about a cost plus pharmacy. So first off, we're one of a select group of PBMs that the cost plus pharmacy will work with. And I love the fact that, yes, there's the Mark Cuban name attached to it. So that is very recognizable, but we have aligned philosophies as far as, high transparency, not having rebates dictate decision-making, lessening the financial burden for members. So for us, it just made sense.
Yeah, so one of the things about, I'm looking forward to seeing what Mark Cuban's pharmacies comes up with next, honestly. We already attacked the highest cost drug, the highest spend drug for all plans nationwide for a long time has been Humira. And so with the biosimilars coming along from Humira, that's increased costs, dramatically over time. I think now it's about $84,000 a year. And we can go through Mark Cuban's pharmacy for, a tenth of that. So it makes a huge difference for our members with the same health outcomes.
Yeah, and just one other drug, and Vikki had mentioned Otulfi, which is the biosimilar for Stelara and Alcina. Stelara is a drug that's upwards of over $20,000 per prescription, and we're seeing a 96% savings when using the biosimilar. So it's just exciting, and it's real-world impact to members as well as clients.